The healthcare landscape in the United States is facing a significant crisis, one that is squeezing both doctors and their patients. As health insurance companies consolidate their power and tighten their control over the healthcare system, particularly over medical practices, physicians find themselves increasingly bogged down by bureaucratic hurdles. They are forced to engage in constant battles with insurers, all while witnessing a decline in their reimbursements and a rise in their operational costs year after year. For those doctors who wish to maintain their independence from large insurance companies or hospital systems, the challenge is becoming more daunting, often requiring external financial support to survive. At various physician conferences where I speak, I consistently hear the frustration of doctors who feel that private investment sources are being unfairly blamed for the dysfunction within the healthcare system. This narrative distracts from the real issue, the detrimental impact that the business models and practices of large health insurance conglomerates have on patient care. Companies like UnitedHealth, Cigna, CVS Aetna, and Elevance have quietly constructed vast, vertically integrated empires. They do more than just provide insurance. They also own pharmacy benefit managers, PBMs, medical practices, urgent care facilities, and data management services. For instance, UnitedHealth's Optum division manages one of the largest networks of healthcare providers in the nation, while CVS Health has merged its insurance division, Aetna, with retail pharmacies and an increasing number of clinics. This level of consolidation is unprecedented and far exceeds what any individual physician group could achieve on its own. Such consolidation stifles competition, drives up insurance premiums, and restricts patient choices. Consider the issue of surprise billing. Many patients are shocked not because a doctor charged too much, but because their insurance company has either removed that doctor from its network or has so severely limited its network that patients are left with no real options. Insurers have exploited the No Surprises Act, which was intended to protect patients, to further reduce reimbursements. As a result, doctors are often coerced into accepting contracts that leave them with no choice but to comply, jeopardizing their ability to keep their practices running. In essence, insurers have transformed a patient protection reform into a mechanism for enhancing their own market dominance. These troubling dynamics are also contributing to a crisis within the healthcare workforce. Many physicians are experiencing burnout, opting for early retirement, or actively discouraging the next generation from pursuing careers in medicine. The root cause of this discontent is not the presence of outside investment, but rather the overwhelming administrative burdens imposed by insurers. These include endless prior authorizations, frequent claim denials, and convoluted appeals processes. As a result, doctors are compelled to work longer hours for diminishing pay, spending more time on paperwork and less time with their patients. It's no surprise that the U.S. is grappling with growing shortages in various medical specialties. The bureaucratic red tape driven by insurers is draining the vitality from the medical profession. When insurers delay or deny necessary care, it is the patients who ultimately suffer. There are countless examples. A cancer diagnosis that goes unnoticed because a necessary scan wasn't approved. A child unable to see a specialist due to a severely restricted network. Or a parent forced to change doctors mid-treatment because their insurer suddenly dropped that practice. These stories are not just unfortunate anecdotes. They are the predictable outcomes of a system where insurers profit by denying care. Each denial, each delay, and every obstacle placed in front of a physician saves the insurer money while shifting the financial burden onto families. Critics of private investment in healthcare often overlook the fact that independent medical practices that have access to the necessary financial resources to remain operational and autonomous are frequently the ones best equipped to deliver high-quality, patient-centered care. What truly matters is whether physicians can maintain the independence to make decisions that are in the best interest of their patients. When private capital is structured to support physician leadership, it can help preserve that independence and act as a counterbalance to the monopolistic tendencies of hospitals and insurance companies. Meanwhile, the largest insurance firms continue to report record profits. They have mastered the art of shifting blame onto others, doctors, hospitals, and even patients for the rising costs of healthcare. However, it is their business model, which relies on consolidation and the denial of care, that is at the heart of the crisis. It's time to stop pretending that doctors and patients are the primary culprits in this situation. The real barriers to affordable and accessible healthcare lie within the business practices and structures of large insurance conglomerates. If the U.S. aims to safeguard physician independence, enhance patient choice, and make healthcare more affordable, it must take action to curb the abuses of insurers. This means enforcing antitrust laws against vertical monopolies, holding insurers accountable when they violate the No Surprises Act for their own profit, and simplifying prior authorization processes so that doctors can dedicate more time to their patients rather than being stuck on hold with insurance representatives. Doctors should be allowed to concentrate on healing rather than negotiating contracts. Patients deserve the assurance that their healthcare decisions are made by their physicians, not by accountants in the boardrooms of insurance companies. Until the U.S. confronts the reality of who is truly in control of the healthcare system, it will continue to misidentify the villains, and the crisis affecting both doctors and patients will only worsen.